Cancer Holistic Guidance, Part 40. Dr. Dilip Gadgil, Pune. According to the Gita, we must not act in order to satisfy our desires. Doing so can help us attain moksha. However, very rarely do people make an effort in this direction. Most people do good and bad things, are reborn over and over again, and generally face both happiness and sadness in every lifetime. We cannot rely solely on this lifetime's actions. What we do in this lifetime dictates what kind of life we will lead, how long we will live, etc. It is important to understand this and act accordingly so that losses and disappointments can be minimized. Your actions must be directed towards doing good things. This is applicable to cancer, too. Walking the right path is necessary and quite an uphill task, too. Figuring out the right path is not easy either. We are so used to relying on the destruction of cells through radiation and chemotherapy, that we fail to see any other alternatives. The right way to look at cancer or any other disease is to identify and address the root cause. If the root causes are found, we can work towards reversing them or working in the opposite direction. And then, if temporary relief is required, you can take the support of radiation and chemotherapy to a certain extent. Let me share another example with you. In 1993, a gentleman was diagnosed with pancreatic cancer with liver metastasis. The doctor told him that with chemotherapy and surgery, he will live for only 2 months. The man was 43 years old at the time. He had a relative who was a cancer surgeon. He consulted him. The surgeon asked him to ditch the allopathic treatment. "What will you do with 2 months of life, anyway?" He advised him to opt for Ayurvedic or homeopathic treatment instead. So, the patient began his treatment under Dr. Nanal, a famous physician in Pune. He survived for 3 years and his treatment went on through this duration. Circa 1996, Dr. Nanal stopped practicing due to his old age and deteriorating health. The patient then came to me and I continued treating him from 1996 to 2004. He was responding well to the treatment, doing well in terms of his business, and had no other problems. In 2004, he suddenly stopped taking treatment from me. He said he was fed up with taking medicines and continuing the treatment.